Assalamualaikum warahmatullahi wabarakatuh and greetings to everyone. In this case study video presentation for Advanced Immunology, we, the Group 6, will be presenting on our discussion for the case study on the topic of systemic lupus erythematosus or SLE. The case scenario provided for this case study are stated as follows. DW is a 25-year-old married woman with 3 children under 5 years old. She came to her physician 7 months ago with vague complaints of intermittent fatigue, joint pain, low-grade fever, and unintentional weight loss. Her physician noted small, patchy areas of vitiligo and a scaly rash across her nose, cheeks, back, and chest at the time. Laboratory studies revealed that DW had a positive antinuclear antibody or ANA titer, positive dsDNA or positive lupus erythematosus, positive anti-SM or anti-smooth muscle antibody, elevated C-reactive protein or CRP, and erythrocyte sedimentation rate or SR, and also decreased C3 and C4 serum complement. Joint X-ray films demonstrated joint swelling without joint erosion. DW was subsequently diagnosed with systemic lupus erythematosus or SLE. She was initially treated with hydroxychloroquine or Plequenil 400 mg and Deltasone or Prednisone 20 mg orally per day, bed rest, and ice packs. DW responded well to treatment and steroid was stopped and discontinued, and she was told she could report for follow-up every 6 months unless her symptoms became acute. DW resumed her job in environmental services at a large geriatric facility.
Okay, question number 1. What is the significance of each of DW's laboratory findings? The first test is positive antinuclear antibody titer. Another test is used to detect antinuclear antibodies in the patient. Normally, immune system produce antibody to aid in fight against infection. However, this antinuclear antibody attack the patient's own cells, specifically targeting the nucleus of each cell. A positive test indicates that the immune system has launched on mistaken attack on their own tissue, also known as an autoimmune reaction. The second test is positive double-stranded DNA antibody test. A positive result for double-stranded DNA IgG antibodies is suggestive of systemic lupus erythematosus (SLE). Anti-double-stranded DNA specifically targets the genetic material, which is the DNA found in the nucleus of a cell. It is assists in the diagnosis of lupus in people who have a positive anti-nuclear antibody test result and clinical signs and symptoms of lupus. The third test is positive anti-smooth muscle antibody test. An anti-smooth muscle antibody test is a non-specific blood test that identifies autoantibodies that attack smooth muscle cells throughout the body. Autoantibodies are antibodies produced by the body that attack its own cells. Positive results indicate the presence of several underlying conditions such as autoimmune hepatitis type 1, hepatitis B, hepatitis C, primary biliary cirrhosis, primary sclerosing cholangitis, and overlap syndrome. The next result is elevated C-reactive protein. It is a protein produced by the liver. It enters the bloodstream as a result of inflammation. Inflammation is the body's way of protecting the tissues after an injury or infection. A high level of CRP in the blood can be a marker of inflammation. A wide variety of conditions can cause it, from an infection to cancer. It is done when an inflammatory disorder is suspected. It does not show where the inflammation is located or what might be causing it. Okay, next is elevated erythrocyte sedimentation rate. ESR test measures how quickly erythrocytes settle at the bottom of a test tube containing a blood sample. A faster than normal rate could be an indication of inflammation in the body. Inflammation is a normal part of the immune system response. It could be a response to an infection or an injury. It also can be a symptom of a chronic disease, immune disorder, or another medical condition. The last lab findings is decreased C3 and C4 serum complement. Low level of C3 and C4 may be a sign of lupus, as lupus patients usually have low C3 and C4 levels during disease flares due to activation of the complement system by the immune complexes. Level of C3 and C4 can reach to normal level again between the episodes.
Question 2. Given that most tests are non-specific, how SLE is diagnosed? The criteria include butterfly rash, discord rash, muscle and joint pains, renal disease, hematologic disease, and neurologic disease.
Question 3. What priority problems were addressed in DW's care plan at the time of diagnosis? First is he must have difficulty in coping and understanding of the diagnosis because he is not from the medical background. Secondly, he also had difficulty in monitoring the pain and temperature because pain and fever is a self-reportory sign and symptom in SLE patients. Third is medication administration and understanding. Fourth is ways to live a normal and safe life diagnosed with SLE.
18 months after diagnosis, DW seeks out her physician because of puffy hands and feet and increased fatigue. DW reports that she had been working longer hours because of the absence of two of her fellow workers. From laboratory test result, it's recorded that the level of sodium is 129 millimole per liter, potassium 4.2 millimole per liter, chloride 119 millimole per liter, total CO2 21 millimole per liter, BUN 34 mg per deciliter, creatinine 2.6 mg per deciliter, glucose 123 mg per deciliter, and urinalysis 2 plus protein and 1 plus RBCs. Question 4. Which laboratory findings concern you and why? As overview, the main laboratory findings that concerns me, there are 3 of it. First, the elevated BUN and creatinine. Second, the presence of blood and protein in the urine. And third, the slightly elevated of sodium and chloride. For the first one, elevated BUN or blood urea nitrogen and creatinine, the normal range for BUN is around 6 to 24 mg per deciliter, while for creatinine is around 0.74 to 1.35 mg per deciliter. For BUN, the elevated BUN signifies abnormality or damage occurred in the DW's kidney. Literally, urea nitrogen is a normal waste product formed after an individual having a meal, which is produced by breaking down of protein in the liver. Simultaneously, BUN is created and it's passed to bloodstream and eventually ends up in the kidney. For healthy kidney, BUN is eliminated through the urine while leaving a small amount of it in the blood. But it is contrast for an unhealthy or impaired renal system, which it will having difficulty in removing BUN into urine, thus leaving much of it in the blood circulation. For creatinine, it is a waste product or metabolite from normal muscle function, which is formed from creatine phosphate, an energy source for muscle metabolism. In normal condition, creatinine in the bloodstream will be transported to kidney and it will be filtered out from blood by the kidneys to be excreted into the urine. Therefore, the presence of high level of creatinine in the blood could be a clear indicator of the occurrence of renal impairment or damage. Second is the presence of blood and protein in the urine, or other known as hematuria and proteinuria. For hematuria, the presence of blood in the urine indicates the kidney or other parts in the urinary tract are permitting the red blood cell to be leaked into the urine. The leakage of blood into the urine can be associated to various factors, including the urinary tract infections or UTI, which due to bacterial invasion via its entrance in the urethra and its multiplication in the bladder. Second, kidney infections of pyelonephritis, which due to entrance of bacteria into the kidneys from the bloodstream or its movement from ureters to kidneys. And the third one is kidney disease, which the urinary bleeding is commonly seen in glomerulonephritis. Meanwhile, the proteinuria, the presence of protein in the urine with consistent and in high level would be associated to kidney damage or other several factors, which is urinary tract infection or UTI, and another one is due to lupus, in which systemic lupus erythematosus is contributed in the development of lupus nephritis, a kidney disease which able to get worse over time and lead to renal failure. This disease is characterized with symptoms of edema on extremities and presence of protein in the urine. Third is a slight elevation of sodium and chloride. The normal range of sodium is around 135 to 145 millimole per liter, while chloride is around 96 to 106 millimole per liter. For hyponatremia or high level of sodium in the blood, it is caused by dehydration due to low water consumption as well as other factors, including kidney dysfunction, such as in this case. In kidney dysfunction, the organ is failed to regulate the passing of water into the urine and resulting to low water content to dilute the sodium in the blood, thus making it concentrated. Meanwhile, hypochloremia, which is the presence of high level of chloride in the blood, is caused by the loss of body fluids through vomiting, diarrhea and fever, kidney impairment, diabetes insipidus, and the usage of drugs such as diuretics. But in this case, DW is possibly diagnosed with kidney failure. This is because kidney is function in regulating chloride balance in the body, which that the imbalance of chloride level in the blood might be associated to a problem on this organ.
Question number 5. How will DW's treatment and care plan likely change? So indicate that the kidney are not working well based on the case progress, so it need to promote the kidney function by reduce the protein intake, eat more fiber, drink enough amount of water to avoid dehydration, lower the salt intake, and limit the alcohol intake. Next, DW need to make medication adjustment by taking back the prednisone and hydroxychloroquine. So, prednisone drug is class medication called corticosteroid. It works to treat patients by replacing the steroids that are normally produced naturally by the body. So in this case, it works to treat the condition by reducing the swelling and redness. However, the hydroxychloroquine is a class of drug called Immunology. This drug are approved to treatment of SLE to reduce the frequency and disease flares. It also contributes to the maintenance of remission, prolong the onset of disease, and reduce the risk of complication for SLE disease.
Question 6. The physician orders cyclophosphamide or cytosine for 100 mg per meter squared per day orally in 2 divided doses. DW weighs 140 pounds and is 5 feet 4 inches tall. How much will she receive with each dose? So step 1 is to convert the weight into kilograms. Next, the height must be converted into centimeters. Then, using a formula, we can calculate the body surface area. Next, we can multiply the body surface area with 100 mg per meter squared. The final step is to divide the dose by the frequency of 2. So, DW will need 84.5 mg for each dose.
Case study progress. DW is seen in the Immunology clinic twice monthly during the next 3 months. Although her condition does not worsen, her bile and creatinine remain elevated. While at work one afternoon, DW begins to feel dizzy and develop a severe headache. She reports to her supervisor, who has her lie down. When DW starts to become disoriented, the supervisor calls 911 and DW is taken to the hospital. DW is admitted for probable lupus cerebritis related to acute exacerbation of her disease. What are the findings indicative of CNS involvement from SLE should DW be assessed for? Number 1, seizure. It is an electrical disturbance in the brain that occurs suddenly. It can alter behavior, movement, or feelings, also level of consciousness. Number 2, decreased level of consciousness. It is the ability to interact with other people and to react to the surroundings. The person may be awake but are not alert and respond minimally to verbal commands. Number 3, muscle tone. Muscle tone changes are what allow the movement. Muscle tone also influence the ability to control speed and amount of movement. PERLA. It is an eye assessment to check for the pupil. It stands for pupil equals size of pupil, round of the pupil, and the pupil reaction to the light and accommodation of the pupil to the surrounding. Number 5, slurred speech. It is characterized by the poor pronunciation of words, mumbling, or a change in speed or rhythm during a conversation. And lastly, symmetry. Observe for the symmetry of clinical features.
Question 8. What preventive measure to be instituted to protect DW at this time? First, seizure precaution. Seizure treatments may include non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen, anti-malarials, steroids, and anti-epileptic medication. Second, infection control. Reduce the risk of infection in SLE patients by vaccination, antibiotic or antiviral prophylaxis, and intravenous immunoglobulins. DW also have to limit the time spent under the sun and inflorescence or
The physician orders pulse therapy with methylprednisolone or solumedrol 135 mg IV every 6 hours and plasmapheresis once daily. Question 10. What major complications associated with immunosuppression therapy will DW have to be monitored for? First is increased risk of infection. In normal condition and functionality, the body's immune system is the line of defense that keeps safe the body and fight off infections that cause disease. However, immunosuppression therapy has resulted to the suppression and weakening of current immune system, thus making the body becoming less resistant towards infections. Second is bone marrow suppression. Bone marrow is the center of the production of blood cells, including white blood cells or other known as leukopoiesis. The undergone immunosuppression therapy by DW had potentially interfered the normal activity of leukopoiesis in the bone marrow, thus resulting to leukopenia. Third is the potential hair loss and malignancy. Literally, most immunosuppressive medication can cause hair loss or alopecia in the patient. Some immune-suppressing drugs used to treat autoimmune conditions like lupus and rheumatoid arthritis can cause hair loss. Meanwhile, immunosuppression therapy had also caused the increasing risk of malignancy as it makes the immune system less able to detect and destroy cancer cells or fight off the infections that cause cancer.
Next, question number 11. DW asks about the plasmapheresis dust and why might it help her feel better. So, what is plasmapheresis? Plasmapheresis, known as aspheresis, which is plasma exchange, is a medical procedure where a device separates a whole blood into cellular component and plasma. Then, the plasma will be discarded and replaced with a colored fluid combined that with the cellular component and returned to the same patient. So, how can DW feel better? It can because plasma exchange can remove putative pathogenic autoantibodies and circulating immune complexes from the blood of patient with SLE disease.
The chart view shows the vital signs of DW. DW returns to the floor following plasmapheresis. The NAP reports to you DW's vital signs. You go in to assess DW and find that she is complaining of a headache and some dizziness. What do you suspect is immediately occurring? Based on the chart, she is hypotensive, which is a common side effect due to plasmapheresis. Hypotension happens due to rapid fluid shift during the procedure. She also suffers from headache and dizziness, which are common symptoms due to hypotension. She may also be dehydrated due to rapid fluid shift during the plasmapheresis. It is said that isotonic losses are 2 times more potent than pure water losses at depleting blood volume. Isotonic losses can alter systemic hemodynamics, reduce blood volume, and reduce glomerular filtration rate. She may also experience tachycardia. Her pulse rate is higher than the normal range for typical resting pulse, which is 100 beats per minute. Some factors that may contribute to this are electrolyte imbalance and low blood pressure.
Okay, next question. What do you anticipate your care of DW will include over the next 2 to 3 hours? Number 1, stabilizing the blood pressure. A plasma exchange can cause temporary low blood pressure and the person may feel breathless. So we need to monitor the vital signs. Number 2, hydrating. A plasma exchange can alter the balance of fluids in the body for a short time, so make sure the person drink enough water. Third, decrease dizziness and headache. The patient may experience headache and dizziness after plasma exchange. Fluid replacement may be needed to overcome the headache. Next, stabilizing the temperature. A person might feel a little bit cold after plasmapheresis. Avoid bathing in warm water to prevent vasodilation. Next, assessing neurological and vital signs. Report any changes on the patient to keep the doctor aware of any complications.
Question 14. What outcome criteria would support that DW condition is stabilizing? First, DW have stable body temperature. Normal body temperature range between 36.1 degrees Celsius to 37.2 degrees Celsius. Vital signs of DW condition shows 36.2 degrees Celsius and it indicates a normal body temperature. Second, decreased report of pain and swelling extremities. Swelling is the result of excess fluid in the tissue which caused by congestive heart failure or blockage in a leg vein. Third, decrease in inflammation. As part of the inflammatory response, the body increases its production of white blood cells, immune cells, and substance called cytokines that help fight infections. Fourth, fight off infection. The immune system protects the body against the disease and infection. When the body detects the presence of germs such as bacteria or virus, the immune system responds and defends the body against these invaders. Once they deal with the germs, they switch off and everything returns to normal.
Next, for question number 15, identify at least 5 topics that DW must be taught before she discharged that might help her lead as normalized life as possible. First, stress management, which is make time to do the thing that she likes to reduce the stress. Number 2, proper hygiene. This is good to keep all part of the external body clean and healthy. Third, medication regimen. This process known as to reduce the medication burden through the strategies. Next is SLE, self-care, which is program that may help DW to learn how to deal with the symptoms like fatigue, joint pain, and swelling. And the last one, follow up with healthcare provider. It is important to keep patient healthier and drive positive care outcomes, and yearly follow-up care can help reduce hospital readmission.
Question 16. You note that DW's husband is visiting her this afternoon. You enter the room as to whether they have any questions. DW's husband states, I have tried to tell her that she cannot go back to work. Sure, we need the money, but the kids and I need her more. I'm afraid that this lupus has weakened her whole body and it will kill her if she goes back to work. Is that right? How should you respond to his concerns? So, as we all know, there is still no cure for SLE, but it is still treatable. Moreover, she is diagnosed with lupus erythematosus, which can cause extreme cognitive issues. So the best advice is to stop working for a while and start focusing on getting treatments as soon as possible. She needs plenty of rest to reduce the risk of flare-ups and relieve fatigue. It is also important to avoid direct sun and fluorescent light exposure for protection against UV light sensitivity.
These are the list of references from various sources which had been utilized in our discussion on this case study. We would like to thank everyone for the attention given for our case study video presentation. With that, thank you.